So a 50-year-old man comes in with 2-day history of muscle pain and dark-colored urine and was recently given erythromycin for an infection. He has a history of heart disease, hypercholesterolemia, and is taking multiple medications. What is the cause of this patient's symptoms? Acute interstitial nephritis, acute tubular necrosis, acute papillary necrosis, or rhabdomyolysis? I'll let you answer the question and then I'll explain. Okay, so the answer is going to be D, rhabdomyolysis. So for this one, we have a patient coming in with muscle pain. So since this patient has a history of high cholesterol, statins were probably given. And then the other clue is him being given erythromycin. So erythromycin is a P450 enzyme inhibitor, and that can actually, so this specifically is in the liver. And so since this inhibits this liver enzyme normally metabolizes other drugs, including statins. And so if you don't have this enzyme that usually metabolizes statins, now you're going to have statins in your bloodstream for longer and at higher dosages. Now having a statin at higher dosages can have the side effect of rhabdomyolysis. And so rhabdo can have increased CK, and then the other signs that we saw in this patient, such as the muscle pain and the dark urine, which is going to be the breakdown of muscle products, and that's going to show up in the blood. And so to treat this patient, we can stop the statin and then use hydration techniques to help reduce the amount of damage it's doing to the kidney. For the other answer choices, we have AIN, acute interstitial nephritis. So that's going to present with fever, rash, arthritis, and eosinophils. And so it can typically be caused by penicillins, NSAIDs, or sulfa drugs. So just look out for any recent medication use of these three. The other one can be acute papillary necrosis. So this can present with acute onset flank pain, fever, hematuria, and pyuria. So getting a UA would show you these two. And then this can usually occur with patients with past medical history of sickle cell anemia, diabetes, or NSAIDs. And then finally, we have acute tubular necrosis, can be caused by aminoglycosides. If a UA is done, you'd see the classic muddy brown cast. And so that's a buzzword that I haven't really seen, but it's good to know about. And so for this question, really just knowing these two medications, knowing about erythromycin and knowing about statins, which they hint at with the past medical history of high cholesterol, knowing the interaction between these two and knowing the side effect of rhabdomyolysis will help you determine that it's D for this question. So I hope that helped, and thanks for watching.